Well, for more on this now, we're going to be joined by a spokesperson for the Mpumalanga Department of Community Safety, Security and Liaison Moeti Mmusi. A very good evening to you, Mr. Mmusi. Thank you for your time at the SABC at this hour.
Thank you very much. A very good evening to you and your viewers at home.
I know that there are still elements developing in relation to the story, but as we, try to make sense of what transpired, perhaps you could take us back to Saturday and the events unfolding to provide context for this chat.
Well, on Sunday morning around 4 o'clock in the morning, the police received a call that there was a shootout at one of the liquor outlets in Barberton in the area. As a result, they responded, and indeed, it was later established that 2 people actually fatally shot at and they died at the scene, while the others were taken to the hospital. So a group of these people, they went to the hospital, and when they arrived there, they demanded that their injured friends should immediately receive urgent attention, implying that the nurses should stop doing everything that they can. Following a meeting that was held yesterday between the Department of Community Safety, Security and Liaison and the unions, we arrived at a determination that we should deploy 4 armed response guards along with a vehicle as part of beefing up the security. Anyway, remember, there is already security on site, but we beefed that up with an armed response, and they also had their vehicle. They were deployed yesterday in the evening. They started their shift already. But when we were there earlier on, we realized that there was still officials protesting, wearing the union T-shirts. So all we can say is that the provincial government is aware about the matter, and so are the police, who are closely monitoring the situation.
Okay, well, Mr. Mmusi, thank you for speaking to the security at the Barberton District Hospital and also speaking to the issue of security now being beefed up. Because, we try to also understand if this is an isolated incident or has this occurred before in Mpumalanga province at large?
It is not an isolated incident. We have had incidences like this previously, particularly at the very same hospital. We would have situations where there would be a shootout at a tavern, or they will have a fight somewhere, and then they would then take this fight to the hospital, whereby upon arrival at these institutions, they would then demand that their friends or who have been injured or members of their gang, if there are gangs in this regard, should be attended to, meaning that the staff at the hospital must stop whatever they are doing so that they can attend to these people. But our securities are working around the clock. Even the police are aware about this matter. But safe to say, we are once again reiterating our call to communities to help us protect hospitals and clinic facilities. Remember, hospitals and community health centers are where people go when they need help in terms of various ailments and in emergency situations such as crashes and other diseases. So when such institutions come under attack, it's a very bad reflection on our society. We know that for the longest of time, Barberton has been one of the most problematic areas, even in terms of the crime statistics that have been released for the 4th quarter now. It puts Barberton among the top 30 priority stations in terms of the number of contact crimes it contributes.
Yeah.
Murder and other assault, GBH, and many other contact crime issues. So it's a problem. It's receiving an urgent attention, even from the sub-provincial management in the province. So it's one of those. So what we saw happening at the hospital is a mere reflection of the situation of crime in Barberton. We have implemented various programs. The police have also implemented various law enforcement initiatives to try and rein in on the area as far as criminality is concerned.
Okay, and thank you for speaking to the broader picture and the systemic issues in society. Based on the preliminary investigations to date, what was the security breach that then occurred if this was not the first time? I mean, what systems were put in place to mitigate against that? How was that then breached on Saturday or early Sunday morning?
As we have indicated, these people, they stormed into the hospital, and then we only have a a limited number of guards at a go or per shift. Hence, a decision was then taken to deploy 4 additional guards, armed response with a vehicle, to try and beef up this situation until normality returns. However, the police are also closely monitoring the situation at the hospital with a view of making sure that the operations returns to normal as soon as possible.
Okay, thank you for clarifying that as well. Just in terms of the perpetrators, talk to us about the arrests that had been made. What's developing on that front as well?
The police are still looking for the suspects. However, we are also relying on the community or members of the public who may have information to come forward and assist the police to crack this case in order to ensure that the perpetrators are urgently brought to book.
Okay, and so because this is now obviously going to be taking it's going to need an integrated approach. You're speaking about, a public call to also assist communities to also come on board. What could possibly be done to ensure that this does not become an occurring phenomenon or a regular feature, particularly at public institutions such as hospitals?
The provincial government, we are looking at ways in which we can beef up securities, even if it means improving infrastructure, putting up of things like cameras, using technology to modernize the way in which we are monitoring our various sites. We've just implemented the new security contract. And then as soon as we have adequate budgets available, we'll be able to improve even infrastructure so that it becomes very difficult for intruders to breach security at these facilities. We are working around the clock. We hold regular security quarterly meetings whereby we discuss challenges at various security sites that we are monitoring and protecting.
All right, and I just wonder if as we wrap up now, we're obviously awaiting the situation to return to normalcy. Healthcare workers have down tools. There's already been a strain on healthcare resources. Talk to us about their demands and what are those timelines then going to look like for them to return and perhaps resume?
Discussions are currently ongoing. We have not spoken to the timelines, but the intention of the provincial government is to have normality returning to the hospital as soon as possible. But those 4 additional guards with armed response, they remain on site, and the police also continue to monitor the operations at the hospital.
All right. There are still more questions and answers at this point, but I'm going to leave our conversation there for the interest of time. Mr. Moeti Mmusi, thank you very much for joining us. Obviously, just in relation to the Barberton District Hospital incident that occurred on Saturday into the early hours of Sunday morning, spokesperson for the Mpumalanga Department of Community Safety Liaison, Mr. Moeti Mmusi, weighing in on what has transpired and, of course, the correct course of action as workers have now down tools, the impact this is having on the community and service delivery as well.